Hey everyone, welcome back. So I can't tell you how many times, middle of the night, you get the phone call from a worried parent that they've messed up their baby boy's circumcision. So some great tips and ideas on how to make sure you keep that circumcision site healthy and healing as quickly as possible. So as far as I know, there are two different styles, two different ways to do a circumcision. The first way, the plastibell, it's not as common, I don't think, and it literally leaves a little plastic ring just underneath the foreskin that will fall off as it heals. So that's what you want, and it's actually the better version as far as what the parent has to do to maintain it and keep it clean, because literally there's just nothing that you need to do except for keep it as clean and dry as possible. So I know it's diaper area, there's poop and pee often, and that's understood, that's to be expected. But you just want to make sure that you don't leave your infant sitting in a dirty diaper for an extended period of time. So with the plastibell, there's not really a whole lot you can do to mess it up. You just don't want it to stay wet or dirty for an extended period of time. The other version is the Gomco, and I think that that's more prevalent. It's more common. I see it a lot more often, and that's when all of the foreskin that is to be removed is removed at the time of the circumcision. So what you are left with your infant is the skin that needs to heal. So with that one, yes, you need to apply Vaseline, petroleum jelly, and things like that, and gauze to cover it. Now, the phone call that I get that I mentioned earlier is usually because even though most of the time we will explicitly tell the parents before they're discharged, you have to apply the petroleum jelly or Vaseline and gauze for at least 2 weeks. Parents get home, they do it for about 3 to 5 days, and they decide, oh, it kind of looks better, maybe I don't need to keep doing it anymore, and they stop using the Vaseline and gauze. And then what happens is the site is not actually healed, so when they fold the diaper down and strap it in place, the skin at the tip of the penis gets stuck to the diaper. So when you go to do the next diaper change and you try to pull the diaper back, you're pulling skin, and of course it's going to hurt the baby and the baby's going to scream out. So there's two styles, like I said, the plastibell and the Gomco. The Gomco requires at least 2 weeks of Vaseline care and gauze. And some people think that the Vaseline is keeping it wet. It's not the same as keeping it wet and moist like a water-based application. So 2 weeks, 2 weeks, please, 2 weeks, no matter what you think it looks like, 2 weeks. There are going to be some secretions and scabs no matter which version you get, and that is again to be expected. Those are normal things that happen. The only thing is that you want to make sure that any of those secretions don't have a nasty odor to it. Kind of smells like dead skin, decaying skin, or something like that. Anything that smells stinky or foul is usually a sign of infection, so you want to go ahead and get that looked at. If it is giving out some pus or some secretions and it looks kind of yellowish, that's actually the healing portion of it. But again, if it's green or red or any other color than clear or yellowish, then you want to go ahead and be concerned and get that looked at as well, because the last thing you want is an infection in that area. As far as pain, there should not be any pain by the time you guys go home. So if at any point in time you're changing the diaper, yes, your baby's going to cry with the diaper change, but if your baby has a high-pitched, shrill sounding cry, those are usually cries of pain, and you may want to go ahead and have your baby looked at. So these are just some tips on how to keep the circumcision clean, and I hope you guys learned something, because that means I've done my job. Bye. See you next week.